Good morning, everyone. I'm Prema Gurunathan, Managing Director of Upstream. We're a partnership between Imperial College London and Hammersmith and Fulham, which is in West London. Our mission is to help turn this borough into a leading destination for the science, tech and creative industries and help transform White City into an innovation district. I'm delighted to welcome you to Tech for Impact, which will showcase businesses who are based in this part of West London. We have 4 speakers from 4 very different businesses, but the one thing they have in common is that they are using technology to improve human, social, and environmental outcomes. Each speaker has 5 to 6 minutes before we turn to Q&A. So please put your questions into the chat function. And now be prepared for your jaws to drop and your mind to boggle as I introduce the first of our speakers. Slight technical hitch. Right, there we go. Our first speaker is Dr. George Frodsham, who is MediSieve. MediSieve is developing and commercializing magnetic blood filtration. This is a new therapeutic platform to revolutionize the treatment of blood-borne diseases. MediSieve has raised over 2.1 million in equity funding and won grants of over 2 million from the likes of the Wellcome Trust, Innovate UK and EU Horizon 2020. George, over to you.
Thank you very much, Prema, and thank you very much for the opportunity to be here. Hello, everyone. Prema gave a great introduction, but I'll say it again. My name's George Frodsham. I'm the founder and CEO of MediSieve, a startup company spun out from University College London and now based in West London in the White City campus of Imperial College. And we are developing a tech that we call magnetic blood filtration. And our ambition is to revolutionize the treatment of blood-borne diseases. And we do that with a tool which is similar to dialysis. And this tool enables doctors to remove a wide range of harmful substances directly from the bloodstream of patients with a high degree of specificity. It's most similar to dialysis in the sense that we circulate a patient's blood outside of their body, passing through what's called an extracorporeal loop. Into this external blood loop, we infuse targeted magnetic particles with antibodies on their surface. These particles mix with the patient's blood and seek out the harmful substance or substances that doctors want us to remove. Those bound targets then continue through the loop into our magnetic filter. The magnetic filter captures the beads, the magnetic particles, and all the targets that are bound to them. And the rest of the blood flows back into the patient unaffected. And so using this method, we can remove a huge range of harmful substances directly from the bloodstream of patients. There are a very large number of awards and organizations that have already supported us in this endeavor. We've been going for 5 years now, and in that time, we've been recognized by some fantastic institutions who have also provided some really strong support for us as a company, from launching as day one, when I was by myself in my bedroom, until today, where there are 12 of us still, a lot of us by ourselves in our bedrooms because of COVID. But there's been a huge amount of support, and London and West London in particular is a wonderful place to be for a company like ours. And we have had some significant press coverage, including the example there in the Sunday Telegraph. As I mentioned, there are a huge number of potential applications for this technology. When we go to doctors and we say, if you could remove anything you like from the bloodstream of patients, what would it be? Depending on the doctor, we get a different answer. We're focusing at the moment on severe malaria, sepsis, and more recently, COVID-19. For sepsis and COVID-19, we remove what are called inflammatory cytokines. These are signaling molecules that circulate throughout your body and drive what's known as a dysregulated immune response, essentially an immune overreaction to an infection. This is what sepsis actually is, and in COVID-19, it is the root cause of what is actually killing the patients. It's not the virus that kills you, it's your reaction to the virus that kills you. And we can come in, remove those key signaling molecules, providing a potential life-saving intervention. But our ambition is for this technology to be a platform, and we've already got our eyes on the next applications, including cytokine storms, leukemia, preeclampsia, autoimmune diseases, and other viral infections. We've already generated some really promising data right here at our labs in West London. We can show removal, as you can see, of up to 20% of IL-6. This is the key inflammatory cytokine that I mentioned to you previously. And we do this with a wonderful team of multidisciplinary scientists, technicians, marketing people from a hugely diverse, different background. I love this slide because I think it's a snapshot of London and what it is to work in a tech startup in London these days. And we really have a fantastic team working towards this. So that's it. That's my summary of MediSieve for you. It is a platform technology with a large potential market, which enables doctors to remove harmful substances from the bloodstream of patients. We're targeting COVID-19, severe malaria, and sepsis. And at the moment, we're actually looking for £5 million of investment, and we've already got some interest. So if any of you out there have deep pockets, are investors or no investors, please do get in touch. My details are there in the bottom left of the slide, or you can reach out to us via social media. And please do also support our team who are currently raising funds for the UK Sepsis Trust by cycling many hundreds of miles throughout the country. So please do go check out our social media to support them as well. Thanks very much for your attention, and hope I got a couple of questions. Thanks.
Right. Thank you, George. I don't like leading with money questions very often, but since you have mentioned that you are, trying to raise £5 million, one of our questions is what's going to be the focus for this £5 million? Which area of development of the company, of the business, is it going to go into?
Thanks, Prima. So as you saw from the data we've already created, we are essentially at the point where we've proven this technology preclinically. And the next step for us to take this into a clinical trial in humans to prove that we're actually having the effects that we anticipate and that the doctors that we're working with anticipate. And that is what this funding is for, is to enable us to do the pivotal clinical trials, to get regulatory approval so that we can get these products out into the hospitals, into the clinics for people who need it. I think we might have lost Prima. Oh, you're back, Prima. But I cannot hear you. There we go.
I'm genuinely back. Right, I shouldn't mute myself between people. Apparently that's bad. So thank you, George. Okay, second question is, and this is where I'm going to reveal my complete ignorance and take my hat off with what you do. You said it's a platform technology. So my next question, you might just go, Prema, please, but has your technology been tested on patients? And if so, what does the data look like?
No, it hasn't been tested on patients yet. We've tested it on animals, and we've tested it in our lab. And that's what this funding round is about, is really about taking it into patients in clinical trials. The first elements you look at are safety. So, just making sure, first do no harm. And then after that, you prove the efficacy of what you're actually doing, both in terms of physically extracting these harmful substances, but also looking at the clinical benefits that those provide in the diseases we're targeting. So right now, we're looking at doing a clinical trial in critical COVID-19 patients, and hopefully we can play, some small role in helping the world deal with this pandemic.
Okay. Can you talk a bit more about the work you're doing on COVID-19, who you might be working with, and give us a sense of the technology? I mean, I know you've given a sense of how it works. Is it very similar to the sepsis work, or what are the differentiators?
It is quite similar to the sepsis work. In some ways, it's a little bit more simple. So I should emphasize that what we do not physically remove the virus. What we remove is IL-6, and that is this signaling molecule, which is a driver of an overreaction of your immune response. And so by removing that signal, we dampen it, we reduce it, and that reduces the amount that your body responds. Because if it goes on too much and for too long, that can actually cause organ damage, organ failure, and eventually death. And that's what's actually killing people. So what's really powerful about the way we use this technology is that you can reduce it to a controlled level. So this isn't about a switch turning the immune response off, because that would be highly problematic for patients fighting a dangerous virus. But we just sort of keep it in check and keep it under control. I say it's a little bit simpler than sepsis, because sepsis is a very broad term for conditions like this, in which there are several of these different signaling molecules that you might want to remove. A very simple example, let's say in COVID-19, it's signal 1 that causes the issue. In sepsis, you don't know if it's signal 1 or 2 or 3 or 4 or 5. So for sepsis, we have what's called a cocktail approach, where we look at removing several of those signals, dampening several of those signals depending on the patient. Whereas COVID-19, we know it's signal 1, so that's what we're going after. And it just so happened we were already targeting signal 1 as part of our sepsis work. So that was quite kind of serendipitous in a way. And we're working with guys in St. Thomas's Hospital, actually, at King's College, and we're also speaking to some people at Oxford about trialing this intervention with them as well.
You're probably one of the few people who are able to say that COVID-19 is not as complicated as the other stuff we're working on.
But I don't want to put words in my mouth. It's very complicated, and I
think the particular aspect you're working on is just about it. Can I take a perhaps a more personal question, which is what made you interested in the sciences? Because a lot of people up here today, kind of go, actually, this is your starting point and this is where you end up. So did you actually want to be a doctor, and what made you go into and start MediSieve?
No, so I never wanted to be a doctor, and I'm not a doctor, and I wouldn't be a very good doctor, because I'm actually ironically not very good with blood or injuries. So I actually started out as a physicist, and even before that, when I went to uni, it wasn't necessarily physics that I wanted to do. I did physics and philosophy, and I was considering even being an actor, and thank God for the world I didn't try to do that. But so I guess it was just a fascination with sort of how the world works and our interaction with it. And that's something I still have today. I think it's very interesting. And I've always been interested in sciences that affect the real world. So, things like, I guess I was less interested in like astrophysics and stuff like that, and like string theory and things, because I just couldn't quite see the practical real world applications of it. Whereas nanotechnology, which is the area that we operate in, has got all this really, really cool new ways that we can interact with the human body, interact with our environment. And I just thought that was an opportunity to develop some really cool and exciting things that could potentially have an impact on the world. And I kind of, one thing led to another, and I stumbled upon this, tried to prove that it couldn't work. And I haven't been able to do that yet. So here we are. Right.
You're slightly leading us into a question from the audience, which is, how did MediSieve identify the need for this technology?
So originally it was actually around leukemia, which is something we're still looking at, although it's taken, I confess, a bit of a backseat compared to sepsis for the time being. And this was a slightly simplistic reasoning, but there was a cancer in my family at the time. And I thought, well, cancer, one of our main treatments is just to cut it out. And well, leukemia is cancer of the blood. So why don't we cut it out of the blood by just removing the tumor? And I knew that it was scientifically possible to stick these antibodies onto magnetic particles, and I could imagine how you can make a magnetic filter, and engineer something that could do it. And so I sort of went, well, why aren't people doing this? And that was what originally started me looking into it. And I thought, well, if we could do it with cancer cells, maybe we could do it with lots of other stuff. And it turns out with leukemia, it's more complicated than I initially thought, because it's not really cancer of the blood, it's cancer of the bone marrow. But by going into this, we found out a lot of things that are in blood that doctors do want us to remove. And that's how we've gone down this path of dysregulated immune responses, sepsis and COVID.
Okay. another question from the audience. It's, what do you think is the biggest hurdle to overcome with this therapy?
A great question, because there are many. So the regulatory approvals are always very challenging for something like this, particularly because it's something that's very new. I didn't talk about this in my presentation, but all of our technology is actually approved as a medical device, but because we have an antibody element, we're a bit of a drug-device combination. And it's used in blood, but it never actually enters the patient's body. So we're in this little bit of the kind of no man's land from a regulatory perspective, and figuring out what validation and data the regulatory agencies in the UK, the EU, the US, etc., want to see to satisfy themselves that this technology is safe, that it's going to work the same every single time, and that it's effective, is very challenging. So that's a big hurdle for us, and it's a hurdle that we need to get over to get into these clinical trials. So that's certainly one. And I think there are a number of others. So whenever you're trying a new clinical intervention, you're never quite sure exactly how things are going to work once you go into humans. And that's true with any new medical technology. And I have no doubt there will be some challenges that we'll face there. And finally, in today's age, I got to say money. It's always a challenge to get investment and to get the right type of investor who believe in the vision of what we're trying to do, and it wants to support, a very small company with a very big ambition. And to be honest, with a few years before we're actually going to get to revenue, because we do have to go through these clinical trials. I'll probably stop it there, because otherwise I'm just going to go through all the hurdles that we have to overcome. But yeah, let's say regulatory, funding, and clinical.
So that's very, very grounding, which is very much rooted here. Can we turn to a fantasy world, which is what I like to call my fantasy investment game? And the question is, aside from investing in your own business, definitely, and any, say, promising COVID-19 treatments, if we gave you a substantial amount of money, 250 million, okay, to invest with the aim of maximizing positive impact, who or what would you back?
250 million.
Well, whatever.
So spread it out. I mean, I think for me, I'd probably focus on environmental things at the moment. For me, I think it's the biggest problem of our times, and we've gone past a threshold, almost certainly a point of no return with technology that exists today. Yeah. And it is a problem that I personally think we have to face with both behavioral changes and technological innovations. And I think we need to be accelerating those far faster than we actually are. And that's probably where I'd put my money, except obviously for the 20 million that would go to MediSieve.
Obviously, right. I think that's all we've got time for. George, thank you so much for a really insightful, thoughtful, and I think heart-rendering presentation on the great work you're doing. I think everyone in the audience and behind the scenes wishes you all the best. And if anybody's got, spare cash, a couple of million, help George. Thank you very much.
Or some spare likes. I'm not very good at social media myself, but please do like and share our stuff on social media and get the word out there. The more people know about what we're doing, the better it is. And yeah, thank you so much, everyone, for your attention.
Okay, thank you, George.
Brilliant. Cheers. Bye.
Okay. Good morning, everybody. I'm just hoping my second speaker is here. Stu? Okay, excellent. Hello. Hi. That was a lovely session with George. Now we move on to our second speaker, who is Ariella. She is CEO of Zamna, which is an award-winning VC-backed software company building GDPR-compliant identity platforms for the aviation industry. Zamna works with multiple airlines, including British Airways and its parent company, IAG, and has been awarded a strategic partnership with IATA as winners of an inaugural innovation award. Again, Irra is going to speak for about 5 to 6 minutes, and then we move to questions from the audience. So please put them into the chat function. Irra.
Good morning, Prima and everyone. Thanks for joining. Pleasure to be here. And I think addressing tech for good has really changed since the COVID disaster struck in our industry with aviation. After everything halted and froze for a while, what happened is that we saw the need to stop innovating and start fixing. To start fixing all of the problems that before COVID were maybe a nice to have to fix, and COVID exposed as really need to fix. So in changing how we fly around the world and changing how we travel, what we saw, and this is indeed how humans became threat vectors of a disease as opposed to just passengers, we saw that governments, border forces, and airlines could not connect the dots between the data sets of who you are as Prima, where you're flying to, and indeed, where have you been before this? So the technology that Zamna has, which we call a persistent identity layer technology, as Prima mentioned, already deployed live with multiple clients. I think the two in the public domain are Emirates Airlines and British Airways. That technology actually enables not only airlines, but also governments to say, can we connect the dots between data sets without creating Big Brother? Very importantly, what Zamna does in order to make the world better also is put security and privacy at the heart of the data that we manage. So Zamna themselves never see the data sets. We enable our clients who are legitimately in possession of the data, such as a government entity or a border control entity or an airline, to see the insight that we return on whether a data set about, for example, your passport is accurate and whether it has been allowed to enter this border before. So today, I'm sure people watching this might agree, sometimes when you're traveling, you feel like you're traveling for the first time and you've never been seen before by an airline who says, welcome back, can we have your passport again? Or a border force that says, welcome back, put your passport over here. It's as if we re-enroll, re-onboard, re-access the same service, the same experience, which most of us living in the UK on this island have probably experienced multiple times before. And what Zamna does in the world for the future and now is to say, hey, this is not good enough. We shouldn't put all of that hard work in the bin, which is exactly what happens today. So we create a reputational data score, and that way we don't know what your passport represents, but we can say, for example, to a client like British Airways, you've seen Prima's passport over 100 times before. Only we don't know as Zamna that this is Prima's passport. So before COVID, BC, we were doing about 100,000 checks a day for just one client. When the aviation industry halted, this gave us actually a much needed breather compared to what's happening now, when we've seen the airlines starting to need what we do, not only as a good practice guide in terms of privacy and data security and data accuracy, importantly, but also the governments coming in hot on the heels of borders closing. It is now an economically critically necessary thing for survival and restarting of international movement of people again to have 100% good data. Otherwise, it's rubbish in, rubbish out. And a border force or a government might be suspecting that you're perhaps a nefarious actor, or perhaps you're a threat vector because of your health, but they can't check. There's something like over 17 different ways to spell the first name Mohammed in the world. And so when you're a border force officer looking for a particular Mohammed, or indeed wanting to speed through a particular Mohammed who's a first-class passenger going somewhere very important, and you want to service this Mohammed with extra loyalty benefits and anything else that an airline might throw at them, it is extremely difficult to identify them, both as a passenger and as a person asking to enter your borders. And that is what Zamna enables clients to do. Now, how do we do this? Now, by way of background, I'm an academic from Oxford, so I graduated almost 20 years ago, which makes me both terrified and semi-proud. I co-authored the first 3 patents with my co-founder, Alex Gorolik, and we now have a team of 20 people based in Hammersmith, and another team who was, until recently, based in Heathrow Airport, where most of our clients were. So we've actually started hiring again And we've gone the other way to everyone else in the aviation industry. And we've recently announced an excellent new hire who was at British Airways previously for 20 years and a director of the Biometrics Institute. In the world that we're in now, hiring in aviation and travel is possibly the last thing anyone else is doing. So we've been extremely lucky to have the ability and the resources and the client demand to go to market and hire out and build new teams. We're very happy to be based in Hammersmith still. We're looking at how we're expanding. I've actually just started the Lord Mayor's International Programme for female founders with a focus on expansion to the US. And we're really positive about exporting our innovative UK homegrown technology into other jurisdictions now that good data in a post-COVID world, whether it's for border force, airports or airlines, good data is no longer a luxury. It is an absolute necessity.
Thank you, Irra. I'm so glad that you're actually expanding in such difficult circumstances. And I think one of the things can we just pick up on, which is a question around good data. And you talk about there's several players in it, government, homeland security, all that. I think perhaps under the subsection of government, perhaps we've mainly thought about terrorism as the main threat, but now it's a health threat. So there are other things which come into play, which I hate to say, track and trace systems, which are useful. So if we don't get to as things currently stand, if we don't get to a very good track and trace system, how does this affect your view of what good data is and how it might play into the aviation system and how we could perhaps start traveling again, but understanding the risk?
Absolutely. This is something that we see at the center of the debate, whereas before Prima, something like that issue would be, again, a nice to have. Data is good enough. It didn't have to be 100% accurate. What we've seen happen are two things. One, collaboration between individual one-to-one governments. So the travel corridors that we read in the press about, such as between country A and country B, it actually started in Asia. I think Thailand was one of the first governments, and Mexico was one of the third governments that created bilateral agreements in order to say, we have good data practices and we're going to trust another government's data practices. A bit of a you scratch my back, I scratch yours. And this is where there was a combination of good data practices and established trust. A lot of it is political. So the Five Eyes, the US, UK, Australia, you could expect political alliances to drive those as well beyond the bilateral agreements. But the secondary one is, as we've seen in the news, monitoring each nation's political status based on the number of cases they had. So that has become part of the conditions of travel, which is where you will see quarantines emerging for places like most recently Greece and Portugal and Switzerland, where we didn't have them before. Those are based on data sets coming out of each individual nation, as opposed to border crossing or any border exchange information. But when you talk about a bigger picture on a global scale, I think I shared the joke that we had in IATA last month that ICAO, the International Civil Aviation Organization, has had so much pressure to create a global standard for what is going to happen. And indeed, the only global standard for data for people crossing borders, the standard in all of our international passports, was designed and created by ICAO, the International Civil Aviation Authority, decades and decades ago. So the pressure is on them to bring all the governments together and to create some form of global standard, whether it's for data or for standards of integrity of those checks that we're already seeing emerge bilaterally. The joke is that governments around the world can't agree on a singular format of a socket plug around the world. So how are they going to agree on a singular format of data? And yet that will be necessary. Most recently, Zamna have actually joined an organization called IBMATA. It stands for International Border Management and Technologies Association. And that is a focused border force focused organization rather than a governmental or a political think tank. In ICAO and IATA, both UN and semi-UN bodies. And at IBMATA levels, you are seeing a lot more practical applications of what does good data look like? What do we need to do in order to assure it between governments? And what do border force around the world need to change in their processes? I would say finally that the UK is actually leading the charge with something called GPG, a good practice guide. It got published a few years ago by the UK government on what identity verification looks like when done well. So has your passport been seen in a secure environment, such as an airport? Has it been self-asserted on a mobile phone? Has it been seen in other aspects of onboarding or enrollment? Has an agent swiped your passport? Has it been read? Has the chip been opened? So there are different levels of data assurance for international passengers. And the UK government has led the charge by creating this good practice guide. And we're actually very high up. We're the top level of the good practice guide in terms of what we do with the data that we verify and what kinds of data we would verify at Zamna. So if you were to just type in, oh, my name is, so-and-so, that wouldn't be treated as verified. And those processes are changing now at government level, both nationally with the bilaterals and hopefully eventually at an international, supranational organization level.
Okay, thank you. I think possibly following on from this question, an audience question, which is, does Zamna's data include biometrics and how has this been affected by COVID? And they've put in brackets, fingerprints, hygiene, face coverings, etc.
So Zamna, again, if you remember nothing else from this talk, but Zamna never ever works with open data. We don't know touch or process open data, whether it's a passport or a fingerprint data set. We wouldn't know what it is. To us, it's gibberish. We are designed as a double-blind technology. We're a validating technology that can tell you if you've seen a fingerprint before, but we wouldn't know what it is that we've recognized for you. In terms of the biometric data sets that are described in the question, it's a very, very legitimate concern. Only 2 days ago, I managed to get back home into the country, having traveled back from Greece, and there was an awful lot of handing over physical documents. I had to say, I'm sorry, you can't touch my property. I will open my passport and hold it up next to my face, but you shouldn't be touching it, whether you're wearing gloves or not. Some people had mobile boarding passes, and the agents were helping those who were struggling to take their phones physically and scan their barcodes. In terms of customer service, that's something we're used to. In terms of hygiene, that is no longer helpful. What this is going towards is what the industry, and indeed IATA, IBMATA and ICAO have long talked about since probably last decade: contactless travel. What COVID has done is accelerated this by about a decade, I think, in terms of speed of adoption. So the biometrics will no longer be a touch surface. The kiosks will be perhaps recognizing you from a different perspective in a different way. And we have seen plenty of technology, most notably in Dubai already. You have a biometric tunnel that you simply walk through. It is touchless. There are cameras recognizing your irises on arrival in Dubai. And again, that's contactless. Everything to do with contactless travel, however, and here's the key thing that we just talked about, it cannot be based on bad data because it's rubbish in, rubbish out. So we know that contactless travel will accelerate. We know that the airports, in the meantime, because of, for now, the legacy process is so physical and so manual, they've simply put up perspex screens. They've limited the amount of handling of people's property. They have put in sanitizing and regular cleaning of touch screens, but to us that is still very intermediary measures. They're immediate responses to, wow, we really must get flying again, but we must do something rather than nothing for now, while the industry itself transforms into contactless travel. Underpinning that with our persistent identity layer and solid 100% accurate data is going to be the future. That's how we will travel.
Okay, I think that's all we have time for. Irra, thank you so much. And I think this is a great case study, not just of actually some positive news coming out of the aviation industry, but I think we're all going to be looking towards you, for our ability, hopefully, to fly again and to fly with a sense of security and comfort. So thank you so much for the great work you do and for joining us this morning.
Thanks, Prima. Thanks, everyone.
Thank you.
Pleasure.
Right, so that was Irra, and we're now moving over to our next speaker. Oops, that's what they warned me not to do, pressed too fast. Our third speaker is Asesh Sarkar, who is CEO of Salary Finance, which partners with employers to offer benefits to help their employees become financially healthier and happier. Very important at this point in time. And they do this by offering simple savings as well as access to a salary as it's earned and affordable loans, all underpinned by financial education. Asesh is going to speak to 5 to 6 minutes, and we're going to go to Q&A again. So please continue to put your questions into the chat function. Asesh, over to you.
Thanks very much, Prima. So hi, I'm Asesh. I'm one of the founders at Sarkar Finance and also our global CEO. So we've been building a business for about 5 years now, and we're really focusing on solving a social problem. The kind of social problem is that about 1 in 2 people in the UK have some form of personal debts. And so maybe that's a credit card, a personal loan, a payday loan, whatever it may be. And people have so much debt, 1 in 2 people have personal debts because in general, kind of people in the UK are quite kind of financially kind of fragile. 40% of people have no savings. Millennials are the first generation in living history to have less wealth than their parents. So in general, we live in a society pre-COVID, particularly post-COVID, which is actually financially stressed. So 1 in 2 people have debt, and debt is essentially a product, but it's a very unusual product. So when you go to a shop, let's say Pret, and you buy a sandwich, that sandwich costs everyone the same amount. Let's say it's £3. Debt is very different. It's a product, it's money, but it costs different people different amounts. And so if you have a loan with a bank, it could cost you 3 or 4%. If you have a loan with a payday lender, it could cost you hundreds of percents, if not thousands of percent. So you have this very strange system whereby if it was a sandwich, and if Pret were charging some people £3 and some people £300, they would be outraged. But when it comes to debt, different people get charged different prices, but it's just very, very normalized. Now, the social problem behind that is, in general, the less you earn, the worse your credit score and the higher price you pay. So in general, and the same applies for age, general, the younger you are, the worse your credit score, the higher you pay. So the kind of the way the system unintentionally works is that, if you are younger and if you're of lower income, a higher proportion of your income goes on repaying these debts. Inevitably, that means you have less disposable income and you have less ability to repay it. And then it causes this kind of endless cycle. So kind of 5 years ago, I kind of really on a very personal level, kind of got exposed to this issue. And so I was fortunate. I worked in the city. I still have personal loans, like kind of 1 in 2 people in the UK. And I have 2 children. We have a nanny. My nanny also had personal loans. And it just seemed incredibly unfair that she was paying, 70 to 80%, and I was paying 3 to 4%. So just, I felt personally quite guilty. And then because I worked in a bank, I kind of said, well, this is quite strange because there don't seem to be bad actors in the bank. What's happening? And essentially what was happening is this unintentional system whereby everyone was looking at data, and the data has become very self-fulfilling, which is if you look at someone's credit file, if you see they have a low score, typically because they're low income to kind of younger, you're giving them a higher price to compensate for that. But then that price meant they were more likely not to pay it. They then don't pay it, and then that proves the data correct. And so you're having these real kind of no bad actors, everyone operating on data, but they're creating these real poor social outcomes where different people paying different prices, and it disproportionately affecting middle to low income people and people on younger ages. So basically, then I obsessed about, okay, so how do we level the playing field? How can everyone get the same access to low cost debt to help them pay it off quicker? And then the key for me was, okay, let's not price in someone's risk based on their credit score. Let's reduce their risk. And so for my children's nanny, I thought, okay, let me offer her a loan. Let me collect the repayment straight from her pay, so I know I'm going to get it back and there's no risk. And then let's see the difference that happens. And it basically, on an individual case, worked very, very well. So my children's nanny, paid off her debts quicker. She was saving more each month. She was very grateful to us. She did a great job of looking after our children because she was less financially stressed. And then you could just see a much happier person. And then my wife and I felt really good about ourselves as an employer, having helped someone without really doing very, very much. So 5 years ago, I thought, look, can we do this on a much bigger scale? I'm an employer of one person. Can we do this for employers across the country? And so then I partnered with Sarkar, which is a venture builder based in West London. And over the past 5 years, we've been taking that one case and basically kind of scaling it up. So today we work with 550 companies in the UK and in the US. Those 550 companies employ 3 million people, and they basically offer what I offer to my nanny, but on a much bigger scale. And so we have 4 or 5 products. So we have salary-linked loans. So if someone has a debt, we repay that debt for them. We collect a small amount of the repayments from their pay each pay cycle. And in doing that, we save them £600 in interest, and we help them get out of debt 6 to 12 months sooner. Their credit score also rises because payroll is on time every pay period, and then we report that to the credit bureaus. We solve the root cause by helping people save directly from their pay each month, so they have some buffer. We help people with protection insurance in case the unforeseen happens, whether it's critical illness or loss of income, then we help protect them against that. And then we also help with financial education and help people get paid at a frequency which works for them. So as mentioned, we now offer these products to 500 companies across the UK and the US. They reach 3 million people. And so in the UK, we reach with police officers, 1 in 4 NHS trusts, 18 of the 19 retailers, and lots, including bank staff, even ironically bank staff. And then, I guess just a few other kind of points along the journey. So we've gone from just me to a team of 300, 140 of those in White City in the Imperial Flemish-Aalschot Scottsdale space, and the rest in India and in the US. We've raised 70 million in equity over the past 5 years with Goldman Sachs, Legal & General, Mutual, and then about £500 million we have lent kind of collectively over that period, about 400 million. And in terms of kind of where we go from here, and so we really want to be very much a mainstream player. So 500 clients, 3 million reach, and it's certainly we have critical mass. But what we want is really this to be available to kind of everyone in the UK, kind of across all the place. Hopefully that's kind of helpful. The next thing I'll probably just kind of end on is in terms of what we want us to hear, we're very big believers in commercial models which align business outcomes and social outcomes. So everything we're obsessed about is the way we make money aligned to good in society. And if it is, then we're kind of doing what we set out to do.
Okay. Asesh, thank you so much. Now, it might be me, but I'm not catching everything you're saying, so you might need to go full volume on when we do the Q&A session, just a warning. But thank you very much for that. I think you're one of the people probably making some employees feel a little happier. Can I just talk about COVID-19 and what its financial implications have been? Have you altered your offering at all to support people through these rather unusual times? Because you talked about sickness and stuff, and gosh, it's not even the sickness of an employee, it's sickness of an international scale. Have you changed your offering or amended it?
Absolutely. So, thankfully, the offering works, across the economic cycles, and so, people who saved with us before, they now have more buffer, which has been very helpful with them. Some people who, an emergency came, perhaps they're still employed, but maybe their partner isn't employed, and maybe there's an additional cost involved, and so we've been able to extend no interest kind of loans to them. And then some people, we offer this product where you can see how much you earn each day, and then you can draw down 50% of your earnings at any time in the pay period. And that's been very useful as people kind of manage their cash flow much tighter in this period. Maybe you do an overtime shift in the supermarket today. You want to be paid in the morning to avoid kind of follow-up. So I would see we've kind of seen all of our products add value now, as they always do. I think we've always lived in a financially stressed society. It's just in certain areas now, and so we've been able to continue to help. But I guess it is worth saying there is a category of people that are actually their finances have improved during COVID-19 as well. So people working at home, they're not spending as much on lunch, on coffee, on travel. A lot of people just don't have time to think about their finances, and they've got a bit of time than usual as well. So it has been very much a mixed picture, but there kind of some positives as well.
Okay. Can individuals, this is a question, can individuals requiring financial advice access your services if their employer is not partnered with you?
No, so at the moment it does require an employer to be signed up to us. And that's really what gives us our kind of advantage and ability to kind of help people. So similar to how I was the employer of my children's nanny, was able to kind of help her. And I guess it's taken us 5 years to get 3 million kind of reach in the UK of employees. But what we're seeing now, particularly with COVID, is like an exponential growth in that rate. And so it took us a long time to win our first supermarket in the UK, but now we work with 19 of the biggest supermarkets retailers. So likewise, it took us a long time to get our first NHS trust. Now we work with 1 in 4, and the same pretty much in every sector. So it does take us a little bit of time to scale up to everyone, but we're kind of making good progress.
And touching on that, because you have been incredibly successful in the space of 5 years, as you've said, what's been key to that success? And allied with that's probably a sub-question, which is, how have you, what were the attitudes of employees when you first went to speak to them? Because I know there's always a bandwagoning effect. So what was that feeling, and what's the main reason for success?
So 2 things. One is, we set out, actually, tech for good today is a recognized term. It wasn't a recognized term kind of five years ago. So it's kind of something, I guess, which is very authentic to us. And 5 years ago, we set out very clearly that, our mission wasn't to build a loans company. Like, loans is just a byproduct. Our mission is to help millions of people become financially healthier and happier. And because we had a mission that people could really resonate with, we've attracted an incredible team of people. And so we have a lot of talent. And where you have a lot of talent focused on a problem which is worth solving, and you get to great things. Whereas actually what you find in traditional financial services, you actually have a lot of talent, you have a lot of smart people, but they're not necessarily focusing on the exam question around how you help society. They're focusing on the exam question is about how you kind of maximize margin. And so for us, the combination of a real focus of a mission, which attracts great talent, and that talent really focused at the intersection of kind of commerce and kind of social, it's kind of really helped kind of build momentum. And then the kind of second thing I would say, we're very, very fortunate on the investment side. So Sarkar has been an incredibly capable, supportive investor, and we're very happy to be in the kind of Imperial campus with them now as well. And then when it comes to going to employers, so the reality is when you turn up and say, I've helped my nanny, can I now help your 200,000 employees? It's not the easiest first conversation. And so what they want is lots of proof points, and so you basically build your way up. So we had to start off with a 10,000 person retailer. We knew the chairman. He trusted us. He knew our motivation was very good. We did a great job there, and then we kind of worked on board. And so and again, that's where kind of good investors can help in terms of getting your first set of clients. So actually, when you have no proof points, everybody is skeptical. When you have, like us now, 500 proof points with 500 happy customers, customers never left us, then it's a much easier sale. So, and 5 years is not a long time, but it does feel like a long time in your first, second, third year as you're building those proof points. So yeah, there's just some momentum at least it goes along the way.
Okay, right. I think that's all we've got time for. Asesh, thank you so much for sharing us, giving us a bit of insight into salary finance, and thank you so much for the work you do, which I think particularly at this time, we've learned the value of the people working in grocery shops and retail and how much they do contribute to society. So thank you for your time this morning.
Okay, thanks so much.
Right. So we move on to our final speaker, last but not least, I should always say, and it is the lovely Michelle Moyo. She's an engineer at Puraffinity, which is a biotechnology startup, and they specialize in designing and manufacturing novel advanced materials for environmental benefits, such as removing harmful pollutants from water and wastewater. Puraffinity raised 2.8 million last year in venture capital backing, and we're delighted to welcome this morning Michelle.
Hi, thank you for having me, and thank you for that lovely introduction. So I'll just jump straight into it. So what exactly do we do at Puraffinity? So we use a unique biochemical engineering process to develop adsorbent granules that have design properties for specific binding. And our IP lies in the process of making these granules. Currently, we have 1 patent that's been granted and 2 patents that are pending. So there are several different routes to market with these adsorbent granules, but our main focus is pollutant removal from different water sources. And this has allowed our vision to be closely aligned with the UN Sustainable Development Goals. And our product aims to address 7 of these goals by capturing and eliminating micropollutants from both potable water sources as well as industrial wastewater. And these are the 7 Sustainable Development Goals that we are trying to tackle. So PFAS, a global problem. So currently there is a crisis in wastewater treatment. Highly toxic and persistent industrial chemicals are polluting our groundwater and even getting into our drinking water supplies. Of the 26 highest impact chemicals on the EU dangerous contaminants list, we are focusing on a group of these chemicals called PFAS. These fluorinated substances have the highest impact based on their contribution to human health as well as the environment. So thyroid disease, high cholesterol, kidney cancer, testicular cancer, and even pregnancy-induced hypertension are all diseases that an 8-year human population study linked to PFAS. And so there's a significant impact as well, especially on low-income population groups living near PFAS manufacturing factories. And a large percentage of the population in general are at a health risk due to exposure. And we've seen some lawsuits a few years back against the likes of 3M. And if you haven't already, I would also recommend watching the film Dark Waters that goes into the ins and outs of what resulted in a $670 million lawsuit against DuPont. And so the EPA and other similar EU regulations cause a particularly huge problem for people that actually use PFAS. And this is because PFAS are found in many different industries, including semiconductors and specialized coatings such as Teflon, which I'm sure most of you may have heard about because Teflon is used to make non-stick cookware. But the highest volumes of PFAS are actually found in firefighting foams. So customers like airports, oil and gas and military installations are mandated to conduct regular firefighting drills. And this would, as a consequence, produce large volumes of PFAS-contaminated wastewater. So this means very expensive and complex wastewater treatment is usually required. And as such, there's an urgent need for a lower cost and more effective solution, which is what we at Puraffinity are working towards. So our breakthrough is our way of producing our granules that capture what others fail to remove. We call it targeted binding of pollutants. Our granular media is optimized to target and capture PFAS compounds in water. And I guess a good way to think of that is how moths are attracted to a flame. So our material specifically attracts PFAS molecules. And so we can either drop our material into existing tanks that look like this one here, the green one, or we can provide self-contained treatment rigs to our customers as a complete solution. But in either case, our granules have the potential to be safely regenerated and reused on site, with the pollutants themselves being incinerated off-site, which is the safest and most cost-effective disposal method. And this right here is actually an example of a self-contained treatment rig that we would then ship to our customers so they could implement and treat their water. So we are currently in the early stages of case studies with various partners, but final full-scale solutions would provide our clients with at least 40% savings. And this is based on reductions in operational costs as well as the reduced frequency in which they would need to replace the media, because we are aiming to be regenerable. So you can reuse our media multiple times before having to replace it. And because our material aims to be selective as well, it can achieve higher percentage removal of these PFAS compounds compared to our competitors. And this is our lovely diverse team of scientists, engineers, and commercial experts. With just a few faces missing there, but we currently have 14 full-time employees, and we are absolutely open to hiring more people locally as well to further elevate innovation within the Hammersmith and Fulham and even wider community. Thanks. I'll be welcoming questions now.
I dare say this session has been a lot more happy and perhaps positive than anyone would have expected, because you're hiring, I think every company we've spoke to this morning is actually in relatively good shape, which gives me a lot of hope despite all the COVID bad news we've got. But can we just move on to what you spoke about, the fact that you are doing case studies at the moment, and then, you're going to be talking to clients, which I suppose it's not just about the client's needed, it's also about the client's interests in the product, perhaps due to increased regulatory demands on them. So which sectors are top of your list for a first approach, if you haven't already done so?
I think top priority would probably be clients such as airports, because they do regularly use firefighting foams, and these contain PFAS. So when they use this in kind of like drills or whatever it is that they're using them for, they do kind of stay in the environment. So they're very persistent. So you could find that there are PFAS that have seeped into underground water years ago, but they're still there. So I think a big client in that regard would be airports. So a lot of them would be looking to treat their water, obviously, and that would be our main priority at the moment.
So that's good. Now, this is a scientific question, so it doesn't come from me. So what sets your technique apart from the other cleaning techniques?
That's a very good question. So what we are trying to do, as I've said, is to make a material that is more selective and that has a higher capacity. So the way in which we're approaching it is that we are trying to design the material itself to have specific binding sites that will attract PFAS only. And whereas other competitors, such as, so what other people tend to use is granular activated carbon. But the problem with it is that it's not selective, so it would actually attract other compounds as well. And you require very large volumes of the granular activated carbon to treat a certain amount of water. Whereas with our material, we're aiming to have less of it and a higher capacity just to absorb the PFAS. So in that regard, we would be able to reduce the operational costs and also the carbon footprint, because you would require less of a material, you can use less space. And so that's what we're kind of trying to do at Puraffinity.
Okay. Now, I know, I think we've spoken about this in the past. Is it a case that Puraffinity has an equal or close to equal split of in terms of a workforce? I'm not sure whether it's just engineers. Could you clarify that and perhaps give us a sense of what it's like to work in such an environment? Because I suspect a lot of people don't work in such environments.
That is very true. Yeah, we have spoken about this before. But so our team is kind of, you can see it there in the picture, is kind of a 50-50 balance between women and men, and is also diverse in terms of cultural background and race. But in general, I think having a team that is not gender biased has provided a very balanced work environment and a talent pool as well, actually. So by having both women and men in our team, I think we've benefited from different points of views and approaches that come from different life experiences. And so I think it sparks a very creative and innovation, I guess, in a way that's different, so we can tackle problems. And for me personally, I think it's enabled me to kind of refine my skills and learn from different people and how they do certain things, and just start to become more confident, I think, in the work that I do.
It's great to hear. Can we play the fantasy investment game with you? We started off with that with George. We'll finish off with you, which, in case anybody wasn't here, which is, aside from investing in your business and any work on the COVID front, if we gave you a substantial amount of money, I said 250 million, whatever, with the aim to invest where you can maximize positive impact in the world, who or what would you back?
I think for what I would want to do, 250 wouldn't even be close to what I want to achieve. But I think just kind of going back to that, those sustainable development goals, I think I would definitely invest in trying to end poverty, just like globally, so that everyone should have basic healthcare, security, and education as well. and eliminate hunger as well, because at the moment globally 1 in 9 people are undernourished, and the goal would be to end hunger. So I don't think it would cut it, the 250 million, but I would try.
Yeah. Okay, that's always good stuff. Michelle, thank you for joining us this morning and for giving us some insight into the great work that you're doing at Puraffinity. Thank you. We've now got 1 minute, so I think I've just about hit the 12 o'clock deadline. So all I need to say now is thank you to our fabulous speakers this morning, and also to you for attending this event. I hope it's been insightful, interesting, and if you would also like to find out more about Upstream, I think somebody in my team is going to drop the Upstream link in there right now. We're going to go and check out what we're up to and find out more about what's going on in Hammersmith and Fulham, and in particular White City. Please do so, get in touch. We also have an event at 6 p.m. this evening with Rush Shaw of Tech London Advocates. It's a fireside chat followed by drinks, obviously online, and networking. So join us at 6 if you can. We are on the London Tech Week agenda. So goodbye, everyone, and thank you for your time this morning.